Back now on Triad today, and I'm very excited about having this next guest because I really want to understand this particular condition. We've never had anybody on to talk about it. Jay Paul, our director, if we can welcome Dr. Mitchell Isaac. He is with Triad Neurological Associates and, of course, presented by the good graces of the folks at Cornerstone Health. And we really love what they're doing and helping the community. And, of course, Dr. Isaac, this topic that I want to know about is something called peripheral neuropathy. I pronounced it correct.
Peripheral neuropathy.
What in the world is that?
It is kind of a weird condition. It can cause a whole variety of symptoms, but basically it's something that causes, it's damage to the longest nerves in your body. So it's a process that affects the nerves that go all the way down to your feet, which is why it primarily affects the feet. People complain of burning, of numbness, of tingling, and of various kinds of pain like prickling or stabbing.
And this is real pain, not imagined.
No, the nerves are definitely irritated. I mean, this is for some people, this condition is so severe that they almost cannot function. The pain is so constant and so ever-present and so severe that, you know, I saw a patient today, basically, who wanted to cut his feet off. He felt that would help the situation.
Lord.
So
Gosh.
It's pretty bad.
You're serious. I mean, the pain gets that bad.
Absolutely.
I mean, does it go by some nickname that we haven't heard? I mean, because a lot of people haven't heard of peripheral neuropathy before. I mean, we know that people who have gout have problems walking. They say, oh, the pain is unbearable. I mean, do people refer to it as other things?
Well, you might call it, some people just call it neuropathy as
Right.
a more general term. Others, because diabetes is commonly associated with it, might assume it's just a plain diabetic problem, which diabetes is related, but it's not necessarily.
Who's at risk for this?
Well, diabetics, of course, are at risk. That's probably, in the United States, the #1 cause of peripheral neuropathy. The #2 cause is alcohol, or chronic, long-standing alcohol use can also damage the nerves and cause neuropathy.
But you could be a non-drinker and also have the problem.
Oh, yeah.
So, I mean, how do you diagnose it? I mean, if it could be masked as other things, how do you get it right?
A lot of it's what the patient complains of. So if somebody comes to me complaining of numbness and tingling in both feet with burning or prickling or stabbing pain or burning pain, those factors almost certainly are from peripheral neuropathy. Now, there's things on exam that I do to confirm it. There's an electrical test called a nerve conduction study that helps also to confirm it, to document the severity of the nerve damage, and basically to show how slow or how fast the nerves are working.
Well, how would you treat it, though?
At present, the treatment mostly revolves around treating the pain. So we can't treat the numbness, we can't treat the tingling very much, but we have decent medicines that help pain. So the burning, prickling, stabbing pain, which are the primary concerns for the patients, medicines do help quite a bit.
Are there any new treatments on the horizon that you're hopeful will make a difference in the future? Or?
There is lots of active research in this area. In fact, our office, Triad Neurological Associates in Winston-Salem, is involved in clinical trials for peripheral neuropathy, among other things. And one of the trials we're doing right now is looking at, hopefully, a cure for diabetic peripheral neuropathy. So, you know, there is things out there that we are pursuing, but at present,
Still a big mystery in large part, though.
Well, we know the nerves are irritated, but we don't know exactly why necessarily, and we often have to just handle the pain, you know, just treat the pain.
That's just, I had never heard of this, although I'd heard of the symptoms before, and now I understand it. Final question, since you're a first-time visitor to the show, why did you get in the medical field? Did you have somebody in your family, a mom, a dad, an uncle, an aunt, who's in the medical field? What drew you to it?
No one in my close family. I was always interested in science. And I don't think I ever had an epiphany of, hey, I want to be a doctor all of a sudden, but it was sort of a gradual process of going through school and realizing that I enjoyed the difficulties and the trials of learning and absorbing information and being able to help people in a very concrete way and being able to have skills that could take me anywhere. I'd love to do medical missions when I get a little older, or get a little more established, I should say.
You look like you're only 15 anyway. Everybody looks young to me. Here's a website I want everybody to look at, www.cornerstonehealth.com. Check it out, and more information on this and many other topics. Doc, will you come back and see us sometime?
Certainly, please.
Thanks so much for helping us.
All right, thank you.
We'll be right back.